Are you wondering what the difference is between a nurse and a nurse practitioner? But first, why are we talking about this? We're talking about this because Aspire and CareMore employ both. And while both are nurses and can do a lot of the same things, there are some important differences. When most people say nurse, they mean an RN, which stands for registered nurse. But not all nurses are RNs, and within nursing there are a wide variety of specialities and backgrounds to prepare them to care for patients and communities. The most obvious differences among nurses is their academic training or education levels. There's the licensed practical nurse, or LPN. An LPN completes about 1 year vocational training and then passing a test to become licensed. An LPN often works under the supervision of doctors and RNs, performing duties such as taking vital signs, collecting samples, administering medication, ensuring patient comfort, and reporting the status of patients. Next, there's the registered nurse. It's important to understand that RN is not a degree, but rather a state license to practice nursing within a scope of practice. Scope of practice is what the nurse is trained and able to do for patients, which can be determined by things like certification, experience, and education. Someone can become a registered nurse with an associate degree, ADN Associate's Degree of Nursing, which usually takes between 18 to 24 months, or with a 4-year college degree, BSN, Bachelor of Science in Nursing. But after their education is completed, both must pass the state boards to become a registered nurse or RN. Both the ADN and BSN can perform the same tasks, but having a BSN often puts someone in a better position to pursue opportunities in education, research, and nurse leadership. An advanced practice nurse completed undergraduate work and graduate work in nursing. Generally, advanced practice nurses complete at least 6 years of academic training after high school, and it's not uncommon for them to study more and get a doctorate in nursing. Advanced practice nurses are educated within 4 major categories: nurse practitioner, nurse anesthetist, nurse midwife, and clinical nurse specialists. At CareMore and Aspire, most advanced practice nurses are nurse practitioners, or NP for short. During graduate work, nurse practitioners specialize in specific patient populations. That's why there are a variety of letters in front of NP. For example, family nurse practitioners, or FNP, adult nurse practitioner, or ANP, adult geriatric nurse practitioners, or AGNP, pediatric nurse practitioner, or PNP. Before they can practice as a nurse practitioner, they need to be licensed as an RN and pass national boards to become certified as a nurse practitioner. So what is the difference between a nurse and a nurse practitioner when it comes to patient care? A nurse can assess, monitor patients, provide nursing recommendations, and escalate to an advanced practice provider or physician for diagnostics or prescriptions. A nurse practitioner can do all those things too and can diagnose, treat, order, and evaluate tests, write prescriptions, and provide referrals to specialists and other services. One last question you may have: why do we call Aspire and CareMore nurse practitioners APPs? Why not just say nurse practitioner or NP? APP means Advanced Practice Provider. And while most of our providers are nurse practitioners, we also employ another type of provider with similar clinical skills, and that's a physician assistant, or PA. A physician assistant is someone who has a 4-year college degree, then goes on to postgraduate work to get a master's degree, then passes a state board licensing test. So, while a PA's scope of practice is similar to a nurse practitioner, the academic preparation and licensure is different. So now you know the difference between a nurse practitioner, and a physician assistant. To sum it up, licensed practical nurse, LPN, they are called nurse and have around a 1-year associate degree. Registered nurse, ADN, goes by RN, we're calling them nurse, and has around an 18 to 24 months associate degree. Registered nurse, BSN, goes by RN, called nurse, with a 4-year college degree. Nurse practitioner, NP, or APP are called nurse practitioners, NP, or advanced practice provider, APP. They have around 2 years postgraduate after a BSN. Physician assistant, known as PA or APP, go by physician assistant, PA, or advanced practice provider, APP, with around 2 years postgraduate.